Good day and welcome to today's webinar. Thank you for taking the time to join us today for our Axxess AI Innovation webinar series. I'm joined today by my colleagues to share See Axxess Intelligence in Action, AI that transforms care delivery. Together today, we look forward to showing you Axxess Intelligence in action across our clinical and operational workflows within our solutions that your teams are using every day. I'm Wendy Conlon, Senior Vice President of Client Experience here at Axxess, and I'm joined by my colleagues, Amy Rose, Senior Product Director, Damini Patel, AI Project Manager, and Austin Amy, Senior Product Director. So thank you for joining us. Before we dive in and really start looking at our Axxess Intelligence throughout our solutions, as part of our AI Innovation webinar series, I want us to remind us about the value and the power of AI, and really, again, how AI is transforming rapidly the care in the home space. AI truly is a force for good in care in the home. And as we embrace it, integrate it into our workflows, which you'll see today, the power and value of what it can do for care in the home and for our organizations is incredible. And we look forward to sharing that with you today. We know that one of our greatest challenges in care in the home is not clinical expertise, but it's time. It's signal overload, and it's that operational friction that we all feel. We know today that our clinicians oftentimes are buried in documentation, and our operators are truly trying to manage scheduling inefficiencies and inconsistencies and prioritizing where care needs may be. All of this takes us to a reactive care model that can really become fatiguing and takes away from that focused, timely intervention that we know patients in the home really need and deserve. And this is really fundamentally where AI changes the model of care in the home. So as we get ready to launch and look at Axxess Intelligence, I want to highlight a few things and the value again of Axxess Intelligence, how Axxess Intelligence really allows our team to operate at the top of their license and their skill set. And what that does is shifts that effort from the manual low value tasks that sometimes we find our teams doing and takes us to more of a high impact clinical judgment and patient engagement model with operational efficiencies that can scale our business. Again, all of that important in today's care in the home industry and landscape. Axxess Intelligence can really be seen as a signal amplifier for our clinicians, an alert, an awareness, so to speak. Think about, as we'll show, some of the clinical insights that we have built within the solution where we're aggregating data and we're taking a look at things like vital signs and symptom changes and general trends. We're surfacing those up for the clinician and looking at what really matters, distinguishing around the noise so that we can have clinically meaningful change and decision making right away. That's a proactive intervention instead of that reactive model that sometimes we live in day to day. Axxess Intelligence also reframes that clinical workflow, and we do that through automation. You'll see that today through our visits, our daily visits, our routine visits. We'll also look at that through our automation, our auto-generated summaries that we have throughout the solution. Those auto-generated summaries are true time savers, reducing that administrative burden that we have on our clinicians. And that gives those clinicians that time back, that valuable resource of time where they can refunnel that energy towards assessing the patient, evaluating the situation, and making meaningful interventions. We want our clinicians to spend less energy documenting and more energy providing that clinical care. We've taken a look at our organizations who are leveraging our Axxess Intelligence throughout our integrated clinical workflows, where Axxess Intelligence is organically doing work behind the scenes and really leveraging that clinical dialogue between what the clinician's putting in and what the solution is gathering. And we see that we are saving over 400 hours roughly by organization annually. Now that adds up over time, and what we can do with those hours to reallocate those hours to make ourselves a better business and to provide a higher level of care is phenomenal. When we think from an operations perspective, and we're going to be looking at that as well, looking at predictive models and allowing optimization and scheduling and looking at that employee proximity mapping, which helps us to route optimize and schedule clinicians where they need to be for which patients they need to see at the optimal time. We're creating a scenario where we have scheduling becoming dynamic and that visit frequency becoming more personalized. When we align those resources to patient need, that's patient-centered care at its finest, which is what we all stand for. For our leaders, we know that AI, Axxess Intelligence, creates that visibility and foresight when it comes to anticipating needs, patient needs, and staffing needs, and identifying those bottlenecks before they happen so that we can ensure that we've got that clinical consistency across the care continuum. That elevates our outcomes. And ultimately, we know in this landscape today, we are outcome driven. And, that performance becomes incredibly important. We want to take our teams, our operating teams, from managing a crisis. Think about how many resources we put into managing crisis day in and day out to really managing the performance. And if we can take our industry to managing performance over crisis, again, patient outcome scales, operational efficiency scales, and financially we become very, very sound and self-serving. And that's important for sustainability of care in the home in the future. And care in the home is where patients want to be. We have, again, taken a look at operational efficiencies throughout our organizations that are using Axxess Intelligence, and we find an average of greater than 1,000 hours saved annually. Now, again, that's significant. That's per organization. Time is money. We know that. And what can we do when we're reallocating those resources of that valuable time and those financial resources, when we can look at more of strategic business growth there, and we can increase our patient outcomes and then ultimately staff development. I mean, that's really poetry in motion. That's phenomenal. That's where we want to be from a care in the home space. So namely, when we think about AI and Axxess Intelligence, it really is a game changer in the care in the home industry, clinically, operationally, and financially. I'm going to turn it over to my colleague Dominique now to share Axxess Intelligence and really how Axxess Intelligence moves through those human care teams organically in the Axxess solution, leading that care and allowing those clinicians to be really thinking with that critical mindset in how they're changing the world of care in the home. So, Dominique, are you ready to show us that real-time value of Axxess Intelligence?
Absolutely. Thank you, Wendy, for explaining how our AI capabilities translate into meaningful return on investments. At Axxess, our approach is practical, embedding secure, compliant AI directly into the workflows you already use, the way that Wendy just explained. And today we're excited to show you exactly what that looks like in present day in our existing EMR. Scheduling is where everything begins and where inefficiencies start to surface immediately just due to the constantly changing variables such as staff availability, geography, patient needs, and so much more. So historically, scheduling has been a very manual and reactive process. Instead of our clinicians having to manually plan their routes, our system will automatically sequence visits to reduce travel time and improve efficiency. So as you can see, whenever our clinicians will log into the application, they will see all of the visits that are scheduled to them for the particular day that they're on. This feature pulls in appointments across different locations and different service lines, making it really easy for the clinician, especially if they're shared across different offices, to manage their day, because then they don't have to switch to different screens and different schedules. With just one click of the Route Visits button, the clinician's day is automatically mapped so they can focus on care instead of coordination, which definitely adds up the way that Wendy just explained. Now, let's talk about what happens when plans inevitably change. Let's say a patient needs to be seen later in the evening, but the clinician is only working half a day. The scheduler now needs to act quickly to fill in that visit because that patient has to be seen today. As a scheduler, I may be working in the Axxess Central platform. And with the ability of our patient calendar page, I can view the map of all visits at my organization. I'm going to specifically zoom into the area that we need to reschedule the patient for. I'm going to locate the patient, and within a click of a button, I can find other nearby employees. Instead of manually clicking and checking different addresses, territories, and availabilities, we can use AI to analyze locations to find the best available caregiver nearby this patient. You can see once this clinician is assigned, the focus will now shift to our clinical workflows. So again, let's route back to the Axxess Planner where a clinician is going to typically start their day. Clinical teams are central to care, yet documentation takes up a significant amount of their time. So the opportunity here is, how do we reduce the documentation burden while improving quality, and how do we support better clinical decisions and reimbursement? As a clinician working on a visit, I can open the visit directly from the central platform. Instead of redocumenting information already in the visit note, AI automatically generates narratives based on existing clinical data. So I'm going to scroll to the bottom of this visit documentation, and you can see here we have a load narrative button. When this is selected, the narrative is auto-generated in the way that we just explained. This results in faster, more complete, and defensible documentation. To help move beyond documentation and into clinical decision support, our clinical insights really highlight the benefit here. So we're going to now move into the home health EMR for a patient that is scheduled to me. When I click into Clinical Insights, this enables organizations to compare a patient service utilization against national benchmarks for patients with similar clinical characteristics to identify opportunities where we can adjust care. So in this example here, for a patient with this HHRG, the industry is seeing this patient about 7 to 10 times within a 30-day period. However, for our organization, we've only scheduled out 3 visits. So we should be having the conversations of, should we be increasing visit frequency? Additionally, according to industry averages, other disciplines outside of nursing are scheduled, such as PT, MSW, home health aide, and more. So should we be also scheduling evaluations to explore further supporting the patient? This tool really helps guide how care is planned and delivered. And once we can accomplish this, the next step is ensuring how we can translate all of this care into accurate billing. As we all know, billing in home-based care is extremely complex due to the different intricacies that it entails. So here, AI plays a role in helping teams submit cleaner, faster claims with greater confidence. To show you how we do this, I'm going to take you to my messages, and you can see on the 1st of the month, I have been sent a Medicare eligibility report. Due to HIPAA reasons, we will not be showcasing real errors or overlapping episodes. However, any of you could go in to messages and you'd be getting the Medicare eligibility report summary. Now, what does this do exactly? Axxess Intelligence will automatically run eligibility checks for our Medicare patients. AI will then compare results to prior checks and highlight any meaningful changes, such as errors running the patient's eligibility, any overlapping episodes that the patient may have with another provider, or even changes to the primary payer. So billing teams can really identify and correct issues before it's too late. Across all of these workflows, there's a consistent challenge. You're interacting with a massive amount of data on various different screens. So how do we make all of this information easier to access and to act upon? We're just going to Ask Axxess. With Ask Axxess, users can do several different things, such as surface actionable insights without doing any manual analysis, such as identifying high-risk patients to help better manage their care. You can see here when I log into the Ask Axxess expanded search, I have several different prompts that can help me use Ask Axxess. If I'm interested in learning about my patients that are at risk of hospitalization, within one click, I'll get actionable insights so I can better manage this patient's care. Now, let's say I am interested in patients that are at high risk, but maybe I'm looking for patients that are high risk of medication management issues, and I'm specifically looking for patients that are on high risk medications such as anticoagulants. All you have to do is search for those terms and Ask Axxess, and the system will generate a list of patients that have these attributes or these characteristics. And as you can see, all of these patients are on medications like Coumadin, Lovenox, and if I click into any of these results, I'll be taken directly to the medications management page in the event that I want to further do any analysis or locate any additional information. Ask Axxess can also help locate information within the EMR to help the user save time and reduce navigation. All you have to do is simply search for what you're looking for. This is a sequence of numbers that is an order number. I can quickly click into the result and from here be able to manage the order without having to open patient charts, orders management, or any other screen. So it really cuts down on the amount of navigation that you're having to do. We're also excited to say that Ask Axxess can also alleviate turnover and onboarding challenges that you may be experiencing by helping new and existing staff quickly find what they need. So let's say as a new clinician, whenever I'm on the mobile app, I see the ability to add infections for a patient, but once my documentation is complete, I can't find my documentation anymore. And maybe they're not aware of where they need to go to see this information. The user can simply search for the page that they're looking for, such as infection list, and we can see that not only does the specific page come up, but relevant help center articles for further support will also display, as well as potential reports that could also help the user access the information they need to. And just like the other scenarios, as soon as you click into any of these results, you'll be directed directly to the page where this information resides. And finally, but last but not least, Ask Axxess can also help get answers to workflow and EMR functionality independently without you having to wait on support from your admin or your mentor or even Axxess. So let's say, again, as a new user, even an existing user, I'm unable to find where I can manage chart of accounts. Let's try asking Axxess, where can I manage chart of accounts? And you can see without having to go anywhere in bold, I can see that I can access the chart of accounts mapping feature by going into company setup into the admin tab. And if I would like further information, I can click into this article and it will give me additional information. When you look at AI at Axxess, the goal is consistent. We are attempting to remove friction from the work you do so you can deliver stronger outcomes. This is what practical and secure AI looks like in the care at home industry, and it's the value that Axxess is currently delivering. Now, we're excited to show you what's coming next. And to do this, I'll now hand it over to Austin, who will show you some of our upcoming AI innovations. Thank you so much.
Thanks, Dominique. Hello, everyone. As Dominique mentioned, my name is Austin Amy. I lead the interoperability product team here at Axxess. And what I want to spend some time on today is how teams are working again across a few different areas. Those areas being intake, coordination, and care delivery communication, and where that tends to break down. In most organizations, communication is happening. It just doesn't always happen in a connected way. You get referrals coming in, and it's happening from different places, and teams are coordinating across different roles, and decisions are being made while people are still trying to gather context. And so what I'll walk through is how that starts to come together a little bit differently within Axxess. And where I want to start is with Axxess Connect. With Axxess Connect, and I'll go ahead and share my screen here. With Axxess Connect, Axxess Connect is a secure HIPAA-compliant way for your team to be able to communicate. Whether that's sending a quick message, looping in the right people, or jumping into a call, it's built directly within Axxess. So communication happens alongside of you instead of outside of it. And now I'd like to walk you through just some different examples of what Axxess Connect can do. And what you're seeing here as far as our different conversations here to the left. You have some individual conversations and you have some group conversations. And with each type of conversation, you're able to collaborate with different teams. Whether if that's you're building a care team, a clinical care team, or if you're building a team for an entire patient, as far as the different clinicians or different people that might be involved in that. And the first thing I would like to show you guys is essentially just starting a new chat. It's as simple as clicking this new chat button here and typing in a name. And since Dominique is here, I'm going to go ahead and just type in her name here and go ahead and type in a message. I'm going to ask Dominique essentially if we could collaborate on her schedule today. And just like that, we're able to send an instant message off to Dominique, and Dominique would receive this via a notification. And with that notification, she'll receive that whether she's on the website or on the mobile side of things. And with that, and I see just Amy just go ahead and message me there today. And so if I wanted to reply, I could go ahead and click on that message and be able to reply back to Amy here instantaneously. The next thing I would like to show you guys is the ability to be able to collaborate from a standpoint of from a group message. And with this group message feature, and I'm gonna go ahead and scroll up because we've had some different conversations back here in the past, and you can kind of see all the different collaboration between me and 3 others. And with these 3 others, we're able to talk back and forth in a manner where we're able to kind of bring everything back into the solution, or stay in the solution and not have this disconnected workflow necessarily. We're able to talk about the patients maybe that we're seeing. We're able to talk about the schedules for our clinicians that need different schedules, and then also we're able to collaborate on different things when it comes to the patients and the employees that they're working with. And a few things that I would like to show you here is just like any chat or communication tool, you're able to reply and be able to like a message. You're able to send a link down here below, attach a file, mark a message as important, and then also you are able to share directly a patient profile and an employee profile with the right permissions. So I'm going to go ahead, and I already have a message typed out here, and I said, hey team, can someone take a look at this patient schedule and let me know if something needs to change? I'm going to go ahead and share a patient profile here. And it's as simple as searching for the patient, selecting the patient, attaches directly to your message, and then sending that off to the team. And really what makes this so powerful is being able to directly click on that patient profile that I shared, and it opens up directly to the patient's chart. And that just continues to enhance the collaboration and the ability to do everything in one connected space. So those are just a few of the features as far as being able to chat back and forth. We also have additional features when it comes to Axxess Connect, being able to make phone calls and video calls. You can do that in an individual setting, or you can do that in a group setting. And I'm going to go ahead and show, and I'm actually going to give a call to Amy just to kind of show you guys what happens here as far as when I make a call. A small pop-up will happen here, and if she were to go ahead and answer here, she would essentially be a new window would pop up, and we'd be able to converse. And it would just be like any other communication tool, but again, it's inside of Axxess. And the next thing I would like to show you that I'm not going to show you necessarily directly through here because we are sharing video, and having a video conference call with multiple people might become difficult. So I'm going to show a little bit of a visual and move on to my PowerPoint slide here. All right. So as you can see here, video conferencing and doing a video call it looks very well in Axxess Connect, and you know, this is happening directly within the platform itself. You're not having to leave or use another tool or platform to be able to do this. So you're not coordinating across those different tools. And then also with all these different features that you can see in Axxess Connect website, you also have this all that functionality carried over into mobile as well. So if somebody is in the field, they're able to work the same way and be able to stay connected the same way as they would on the web. And now I would like to transition over to another area that tends to get more challenging, and that area is intake. It really comes down to how information is coming in and how it's getting processed. So you're getting referrals in from different sources in different formats, and those clinical details spread across multiple documents. So before a decision can ever be made, there's a lot of time being spent trying to understand what's even there. So that's where the intake agent, which you see here, powered by Axxess Intelligence, really comes in. So I'll walk through a little bit of how this example works and how the intake agent works, and when a referral does come in and it's getting processed. So as that referral is coming in, as you can see here, the referral can come in whether if it's coming from an eFax, you're uploading that referral, or if you're getting that from electronic referral partner. And that can be uploaded here within this screen. And as it's being uploaded, once it goes ahead and completes, the intake agent starts to identify key details and pulls information into a more structured format. And as that continues, and as it brings forward the information that actually matters, your team isn't working through everything line by line. They're getting a clear sense of what's relevant. And then finally, this is where you get to see of how this really works and where the work really starts to show up and what intake agent does. As you can see, the referral has been filled out and the information is carried into the right places. So instead of going field by field or referencing multiple documents, your team is starting from something already organized. Alongside of that, you have a care summary. This gives you a quick view into what's going on clinically without reading everything that came in from that referral. And at this point, the work really shifts. They're not building a referral anymore, they're reviewing it. They're making sure it looks right, deciding if it's appropriate. Most importantly, they're able to move forward so the patient can get the care they need. This is where time is saved because you're not spending as much effort getting to that point. So when you step back and look at this all together, communication stays connected directly in Axxess, and intake becomes more structured before someone even touches it because of the intake agent. And those two combined make it easier to keep things moving. And it's not about adding something new to the process necessarily. It's more about reducing the effort it takes to move information from one step to the next. So from here, I'll hand it over to Amy to build on this and walk through what Axxess Intelligence and agents look like further downstream.
Thanks so much, Austin. It was so fun to interact with that demo with you through my central application. I just thought I can jump on there and show some things. So thank you so much for that. Hi, everyone. I'm Amy Rose. I lead the hospice and palliative products here at Axxess, and I am so excited today to show you one of our brand new Axxess Intelligence features, which is ambient listening for skilled nurses in our hospice platform. This is something that we have been working diligently on, and as all of my colleagues have mentioned, has such a tremendous potential to impact real clinician satisfaction, real clinician accuracy. We are seeing a lot of data coming in about how much ambient listening can actually improve accuracy of data, because we all know as clinicians, I am a nurse, and at the end of a 5-patient day, my clinical documentation is probably not as good as my first patient of the day, because I have a human brain and not a computer brain. And when we are point click documenting, there is just an element of human nature that shows up in that process. Ambient listening does so much to mitigate a lot of that process. So without further ado, I'm going to be sharing my screen from my iPad, and I want to demo for you today what ambient listening looks like in our mobile application today. So I'll be switching over to our Axxess Hospice application. And once I log in, I'm going to show you 2 different patients. I'm going to show you a patient that I have not documented on yet. Maybe I am headed to her house and I'm going to be putting on my ambient listening tool while I am giving care to her, which is an option for ambient listening. Or there's a potential that after the patient's care, I can verbalize through that patient care with ambient listening. And it can document that work. So as I navigate into my visit note, the first thing I'm going to see is this intelligent listening screen. And if I want it to listen, like I said, whether that is with appropriate permissions during the visit or after a visit has occurred and I'm verbalizing through that care, I'm going to click on that microphone button at the bottom of my screen, and I'm simply going to start dictating my visit, or I'm simply going to start navigating my visit. This is capable with or without Wi-Fi, and it's going to be all inclusive into your application, so we're not going to jeopardize any patient PHI here. So I'm going to skip over to a patient that I saw earlier today where I was able to do a transcript of their care. So as I narrated their care, it was generating a transcript. Once I'm done with that transcription, I can give it a couple of minutes to generate this, and then I can click load visit note. It's going to tell me anything I previously documented. It's going to override that. Are you sure I want to do that? I didn't even bother to start documenting within the note because this is a great place to start. So I'm going to click yes to that. And then we're going to see the magic happen. As my note now opens, you can see here on my left-hand side, all of those gradients you've seen behind all of us today in this demo, and also throughout all of my colleagues' demos. When you see Axxess Intelligence, there is that gradient that appears. As I navigate throughout the solution, I'm going to also then, or as I navigate throughout the visit, you're also going to see these little sparkle symbols. And those sparkle symbols mean that AI picked up on this particular thing and integrated it into my visit. And so you can see here, as I dictated all of the vital signs for the patient, that came up. There was some context information that it picked up, and it made some assumptions about a FAST, an NYHA, and a KPS score for me. Now, as a clinician, and true for any AI or ambient listening, I need to use my clinical brain to also then validate that information, because ambient listening is only as good as we are as clinicians and showing up and validating, because that's where I can use my brilliance, right, as a nurse, is to understand, okay, this is almost right, but not quite right. So I'm going to overwrite it with my clinical judgment. So same thing here for all of my physical assessments. It's picking up on all of the documentation that I did verbally. It's doing a pain assessment for me. And all the way down, as we start talking about hope-related items, it's also indicating symptom impact, and symptom assessments. So if I'm within my hope window, I have some support there as well. Again, as I navigate through and validate that my clinical judgment agrees with that ambient listening. So here I have dictated this visit in about 10 minutes, and I have a fully documented visit to go along with that. So we are so excited about expansion of this ambient listening tool and seeing this really throughout the patient's experience and care. And with that, I will have my colleague Wendy Conlin close us out.
Truly exciting. Thank you, Amy. That is amazing. And thank you, Dominique and Austin. And what a great demonstration of our real-time Axxess Intelligence throughout our workflows. Truly appreciate the knowledge share. And I can say I learned some things today that I will be passing along to our clients. That's just exciting and efficient. I think we did prove out today that Axxess Intelligence really is reshaping the future of care in the home and care delivery. And the significant value that Axxess Intelligence brings to our organizations leveraging their business through Axxess technology. It's powerful and meaningful. And when we think back to what AI and Axxess Intelligence can really do, it transforms our business and our team's focus from tasks to outcomes and from volume to value. And that's where we want us to be. And from that generalized care to a more precise and tuned in intervention, meaningful intervention for our patients. And that is truly the future of care in the home. So thank you. Thank you very much. Thank you, Dominique, Austin, and Amy for presenting with me today. And thank you to our audience here. To learn more about how Axxess Intelligence can help your organization become an AI-first provider, visit axxess.com. Please also look for an email from Axxess in the next few days with a link to this webinar recording and the recordings that of our previous webinars in the Axxess AI series, so you can stay up to speed with Axxess and truly Axxess Intelligence.
Thank you for joining Axxess On Demand. Visit axxess.com for more on-demand videos, industry resources, blogs, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.